Hello and welcome. You know, dealing with hemorrhoids can be really uncomfortable and honestly a little concerning. But just understanding what's going on in your body is a huge first step toward feeling better. So in this explainer, we're going to break it all down and give you the clear, straightforward information you're looking for. So here's our game plan. We'll start with the absolute basics of what hemorrhoids even are. Then we'll dive into why they can become a problem. The symptoms and causes. After that, we'll talk about the powerful things you can do at home. And finally, we'll walk through the medical options your doctor might discuss with you. It's a simple roadmap, so let's jump right in. So, first things first, what in the world are hemorrhoids? Getting a handle on the basic anatomy here is so important, not just for your own curiosity, but because it really helps dial down any anxiety you might be feeling. Okay. Now, this is probably the single most important takeaway from this whole explainer. Hemorrhoids are a completely normal part of your body. Seriously, everybody has them. Think of them as these little cushions of tissue that actually help with continence. They only become a problem, what doctors call hemorrhoidal disease, when they get swollen and start causing symptoms. So, we basically break them down into two main types, and it all depends on their location. You got internal hemorrhoids, which, you guessed it, are on the inside. They're covered by a lining that doesn't really have pain-sensing nerves, which is why they usually don't hurt. Then you have external hemorrhoids. They're on the outside, covered by skin that is very sensitive, and that's why those are the ones that can be pretty darn painful. For the internal ones, your doctor might also talk about a grade. Now don't worry, this isn't like a report card. It's just a really simple way to describe how much they might be protruding. It goes from grade I, where they're just a little swollen, all the way to grade 4, where they've prolapsed and just won't go back in. This grading system is incredibly helpful for figuring out the best treatment plan for you. Okay, so if hemorrhoids are totally normal, why on earth do they become such a problem? That's the big question, right? In this next part, we're going to get into the common symptoms and what's actually causing them. For most people, the symptoms are the whole issue. So let's look at the classic signs that tell you those normal little cushions have gotten irritated or enlarged. The number one classic symptom of internal hemorrhoids is painless bright red bleeding, which you might see on the toilet paper or in the bowl. You might also feel a little bit of tissue coming out or notice some itching and irritation. Now here's a really crucial point. Pain is not a typical symptom unless an external hemorrhoid gets a little blood clot in it. That's called thrombosis, or an internal one gets strangulated. So, what brings these symptoms on? Well, it usually boils down to increased pressure in that area. Things like straining when you're constipated, spending way too long sitting on the toilet, or even pregnancy can all contribute. But here's the good news. A lot of these are things you can actually influence, which leads us perfectly into our next section. Okay, this part is all about putting the power back in your hands. Because for most people, the absolute most effective treatments are simple things you can do right at home to get your symptoms under control. It really comes down to three key things. First, change your habits on the toilet. Don't linger there with your phone. A few minutes is all you need. And a little footstool can make a huge difference. It just puts your body in a more natural position. Second, think about your stool. You want it to be soft. Fiber is like a sponge. It soaks up water and makes everything softer and easier to pass. And third, a simple warm bath, what we call a sitz bath, can feel incredibly soothing. And I really want this to sink in. These aren't just little tips. This is the first-line medical treatment. For a huge number of people, just making these simple changes is enough to get major, long-lasting relief without ever needing a procedure. Now, what happens if those at-home strategies just aren't cutting it? Well, that's when it's time to team up with your doctor and talk about some other options. We're going to look at the two main categories of medical treatments right now. This slide gives you a fantastic bird's eye view. On one side, you've got office-based procedures. These are generally quick, done right there in the clinic, and have a pretty easy recovery. They're best for those lower-grade internal hemorrhoids. On the other side, you've got surgery. This is for more advanced cases. It's done in an operating room and involves a longer and more significant recovery. Let's quickly look at those office procedures. Rubber band ligation is super common. A tiny little band cuts off the blood supply and the hemorrhoid tissue just falls off in a week or so. Another one is infrared photocoagulation, which uses a little bit of heat to create some scar tissue and shrink things down. And then there's sclerotherapy, which is just an injection that makes the hemorrhoid collapse. They're all designed to be pretty simple and effective for the right person. Now, when we talk about surgery, the gold standard is what's called an excisional hemorrhoidectomy. That just means the hemorrhoid tissue is completely removed. It works really, really well, but, and this is a big but, the recovery is definitely painful. Other options were developed to be less painful, but they might come with a higher chance that your symptoms come back down the road. That's the key trade-off you and your surgeon will talk about. No matter what procedure you might have, managing the recovery period is absolutely critical. Your doctor will set you up with a solid pain management plan, and all those good habits we talked about earlier, the fiber, the water, not straining, they become even more important to make sure you heal up smoothly. Complications are rare, but it's always good to know what to look for and to stay in touch with your doctor's office. So we end with this question for you. The whole point of this explainer was to arm you with knowledge, because knowing the basics of the anatomy, the symptoms, the different grades and treatments, it does more than just lower your anxiety. It makes you an active partner in your own healthcare. Now you can walk into your appointment ready to ask great questions and work with your doctor to choose the absolute best path forward for you.